What is the best way and the safest way to stimulate the ovaries to get more eggs? And does collecting more eggs hurt the ovary or help the chances of getting a pregnancy? And this was a recent letter published in Fertility and Sterility. Recent evidence shows that aiming for more eggs is not necessarily harmful as long as embryos from all the cycles, fresh and frozen, are used. This challenges an older belief that getting more eggs, which is about 10 eggs, is always bad for quality and outcome, and that is not being proved correct. In reality, having more eggs can give couples more embryos to work with, which can increase their overall chance of having a successful pregnancy, especially when using frozen embryos. Safety remains first, and second, the feasibility of getting more eggs. Some women respond very strongly to ovarian stimulation at a risk of ovarian hyperstimulation syndrome, the serious side effect of IVF. Advances in freezing of eggs and embryos has shown that frozen eggs and embryos tend to do a lot better. The second thing is that very much the number of eggs you get is dependent on age, on your AMH, and on your follicle count. As age advances, you're more likely to get less eggs. If your AMH is low, you're going to get less eggs, and if your follicle count on a scan is low, you're going to get less eggs. So, if you can, getting to 8 to 10 eggs will give you the best chance of getting to more embryos. Again, the use of dual trigger is beneficial, but it is again based on whether you're not running a risk of overstimulation. What this letter did suggest is that choose your protocols carefully. If you can get close to 8 to 12 eggs, that's a much better chance of getting a pregnancy. But in cases where you can't, you'll have to work with lower numbers and try and do your best to prevent ovarian hyperstimulation syndrome.